I'm Raymond Powrie, and I'm the Chief of Medicine at Care New England Health System. And I'm working along with a very broad team in managing our response to the COVID pandemic. This short video is about our vaccine that will begin to administer, hopefully early next week, if it's approved by the FDA for emergency release this week. We have a series of questions we want to go through with you and make the answers available to you. And the questions are as follows. First, what's happening with respect to the vaccine approval and distribution right now? Today, an expert committee that's been assembled by the Food and Drug Administration is reviewing all the data about this vaccine. We're talking about the Pfizer vaccine, and what they are going to do is make a recommendation to the FDA independently as to whether or not they think this vaccine is both effective and safe, whether any risk that's identified is warranted by the benefits of that vaccine. We anticipate that will be what that committee recommends, and that the FDA will subsequently make the decision to release this vaccine for emergency use to help us control the pandemic. We're very excited about that. And that will then lead to our ability to distribute the vaccine. So that leads us to our second question. Is Care New England ready to begin the vaccination? Well, I just got off the phone from one of a long series of meetings we've had to prepare our plans for how we will receive, store, and administer the vaccine in a way that we can get to our employees, our healthcare workers who are providing the critical support for this pandemic in a very timely fashion. So yes, we are ready and have a good plan in place and hope to begin early next week. Our next question is, how much vaccine will Care New England get with the first shipment? Well, we just found out last night that the state will, in the following next few weeks, give us enough to vaccinate almost 5,000 of our employees. This is wonderful news for us. We didn't anticipate such a generous offering to the Care New England healthcare system. This will not all come in one day, but we'll have some come this week, some come next week, but we anticipate that we will have supplies in the short term, in the following weeks, to vaccinate up to 5,000 of our workers, which is a wonderful thing, as I've said. There will be subsequent vaccine supplies that come both to the hospital and more broadly into the community. So we do believe that as we go further into the winter, we will have very broad supplies to the people of Rhode Island, and that the state's done a very good job procuring these vaccines for us. I do want to mention there are two distinct vaccines, one made by Pfizer, which is being potentially reviewed and approved today. And then there is also the Moderna vaccine, which will be evaluated by the FDA's specialty committee next week. And we hope it will also be released for emergency use next week. Again, all of our supplies are contingent upon the FDA's good work, one of the best organizations in the world for this work, assessing whether or not this medication is safe and effective for us. So the next question is, how will we decide who will get the first vaccination? It is our intention to make sure that every single one of our employees who desires the vaccine can receive it. And we want to do so in a timely manner. But in the short term, we are going to need to do a stepwise approach to the release and administration of the vaccine. And in that regard, the first step in our systemic rollout to all of our employees will be to give the vaccine to those people who are directly presently caring for COVID patients, or whose job descriptions means it is more likely they will have an exposure to COVID. Again, it is our intention to get the vaccine to everyone as soon as we can, and we have significant supplies, but we do have to be able to get the vaccine into people's arms, and the first arms that will be receiving it will be those who are presently caring for COVID patients. That makes sense in terms of our job to make sure that our workers are safe and healthy to continue to care for those people who continue to become ill from the pandemic. The next question people ask is, what is Care New England's general perspective on who should be getting the vaccine and how we should approach that stepwise systematic approach? And again, I've already said it, our intention is that every single one of our employees who wants the vaccine should be able to receive it. Our approach, though, is to start with those who are presently being exposed as part of their day-to-day work to patients who have known COVID or are likely to have COVID, or they are unable to protect themselves because of the required intimacy or proximity of their exposures. I think that makes sense to any reasonable person, and it is not at all an effort to say that every single one of our workers isn't valuable to us and important in the work that we do. But the idea is that we do need to keep our workers healthy in the workplace and make sure that we protect those who are most at risk in the short term. The next question that we ask is that people have heard that there are 2 doses of the vaccines, and they want to know if that's true. And that is true, that this vaccine, when it was studied always with an administration of 2 doses. 1 dose the first day, and then another dose for Pfizer 21 days later, and for the Moderna vaccine 28 days later. We will be doing that for our employees as well. It was done that way because the researchers believe that 2 doses will be better at getting a stronger immune response. It would last longer to protect a person. And so because that was studied, that's what we're actually also going to do as well. And I do think it makes sense and is similar to many other vaccines where we give more than 1 dose to make sure that the immune system develops a strong and as long-lasting a response as possible.
Hi, I'm Dr. Erica Hardy, and I wanted to answer a few questions about the new SARS-CoV-2 vaccine that we're getting. One of the questions I hear is the vaccine safe? So vaccines do go through a very rigorous testing process, phase 1, 2, and 3, and these vaccines will have all gone through that whole process as they would for other vaccines during other times. They've been tested in thousands of people, 40,000 in one of the vaccines and 30,000 in the case of Moderna. So that's what we know so far. So they will be licensed and for emergency use if the benefit is thought to outweigh the potential risks. Question about, are there any side effects? It looks like with both of these vaccines so far that there are some self-limited side effects, mostly injection site reactions and some non-specific symptoms like fatigue, achiness, occasionally fever, but that these do go away within several days. Some of the other questions that we don't know the answer to yet are, how long does the immunity last? We don't know this. We're still learning a lot. These are brand new vaccines. We're still learning about whether immunity lasts from infection after COVID-19. And so we don't yet know how long immunity from the vaccine will last, but there's a lot of ongoing research to help answer some of those questions. And then one of the other questions is, will I have to wear a mask or continue precautions once I'm vaccinated? For the time being, yes. The recommendation will likely still be to do all of the things that we know work, minimize contact, people, universal masking, universal hand washing, and things like that, social distancing. So all of those things we'll still be doing, but hopefully the vaccine will start to enter the population and begin to protect us. So when my turn comes around, I plan on getting the vaccine as well.
I hope these answers to your questions are helpful to you. We'll continue to communicate with you as we learn more about the rollout of the vaccine, and we'll also continue to communicate with you as we learn more about the benefits and the things we learn about how people react and respond to the vaccine. We also welcome your questions and concerns, and we ask you to reach out to any member of the team of your COVID trio at Care New England, or the leadership at your own hospital or your operating unit. We want to be helpful and make sure this process is as comfortable to you as is possible. I do believe this vaccine is going to be important as one of the tools by which we control the pandemic and begin to restore the fullness of life that we all have previously enjoyed prior to the pandemic. And I do want to remind people 2 things. One is that the vaccine is only one of the tools, that masking and social distancing is still important, and the use of PPE in all clinical settings as appropriate is still essential. The vaccine is not a cure-all. It is an important part of our toolkit. The next thing I want to do is that I know there are a lot of mixed feelings that exist in the community about vaccines in general, but I do think that One thing we do definitely know is that COVID is killing large numbers of Americans, and that in Rhode Island, we have one of the highest rates of transmissions in the world right now, and that there may be theoretical concerns that will evolve about the vaccine, and I understand people's concerns, but we do know one fact is that COVID is the danger to our population and those people that we serve daily as a healthcare system, and that I think that taking the vaccine is an important statement about our commitment to the community. I would also like to say, people are asking, will I take the vaccine? Yes, I will take the vaccine with enthusiasm and gratitude, but I will also take it in a time consistent with my exposures in my day-to-day work, and be happy to participate in the stepwise approach to the rollout of this vaccine.